Good afternoon, everyone. Thank you all so much for being here. And thank you, Mr. Mayor, Mrs. Kennedy, and Dr. Graham for joining us today. So when I started this job 20 years ago this week, I didn't need these. But I do today, so I hope you'll indulge me. So, and also through the whole 20 years, when people ask me at a party, oh, tell me about the work of the Center for Community Health Improvement, I'm always challenged to do that in a soundbite or an elevator speech. So I'm going to spare you that attempt today and instead try to give you a snapshot of CCHI over the past 20 years by sharing one number for each of our 5 key priorities. So, first, 5,000 Boston, Chelsea, and Revere public school children have had opportunities here with Mass General to be exposed to science, technology, engineering, and math, whether it's our partnerships with the Boys and Girls Club of Boston, our paid internships and summer jobs, or our college scholarships and social, emotional, and academic support. Next number. 9,000 victims of violence have been assisted at this hospital, either through our domestic violence program, Haven, as part of our social service department, through our violence intervention advocacy program in our emergency department, or the police action counseling team, a partnership between MGH Chelsea and the Chelsea Police for child witnesses to violence. Third number, really like this number, it's a big one. So over the past 6 years, Chelsea public school children in grades pre-K through 4 have engaged in 300,000 additional minutes of physical activity due to their partnership with our Healthy Chelsea Coalition. Next number. Since 2010, 229 people who overdosed on opioids have been saved by the Revere Fire Department, the first fire department in the nation to carry naloxone or Narcan, which reverses opioid overdoses. And this is thanks to a partnership with the Mass Department of Public Health and our Revere Cares Coalition. And finally, since 2001, 16,000 vulnerable patients have been navigated to cancer screening and care by a culturally competent team who works with the patient to figure out what is keeping you from doing this and let me help you overcome it to get this potentially life-saving care. So, needless to say, we have not done all of this alone, and this is just a quick snapshot. So, first of all, we do everything in partnership with the local communities. This would not have been possible without the commitment and leadership of Dr. Peter Slavin, as Joe said. When people from around the country, my colleagues from around the country say, how do you do all this at Mass General? I say, nothing replaces committed leadership.